And as Sanjay mentioned earlier, AI, data, it is consuming all parts of our lives, right? Sanjay, you said it's affecting the way we live, we work, we play. I think we all agree it is doing that. It is really reverberating across so many industries. But I think it's fair to say when it comes to healthcare, the use of AI, of cloud technology, of data, it can be truly life-changing. And the goal, of course, whether you come from it from creating the technology where a computer can read an X-ray or working with cloud technology, the goal is the same, which is to reduce costs and eventually improve patient care. That is the #1 goal. So in the next half hour, which is the time we have, I do want to talk about the potential of AI and data and cloud technology. I want to talk about the potential. I want to talk about the challenges and the limitations. And I also want to talk about the ethical issues, because there are a lot of ethical concerns about using data and AI when it comes to healthcare. So I'm going to get started right away with you, Kevin, and ask you, I know you're working on a technology that will allow computers to read X-rays, but how far are we from a time when I can walk into a clinic and I don't meet a doctor, but I meet a robot doctor? Is that going to happen?
I think it really depends on in what way you envision the computer being involved in the circumstance. Everything that we build is about assisting clinicians with their clinical workflow, because we recognize that, especially with the modern state-of-the-art of technology, there are still things that should be left for people to do. And at best, modern AI is really a fancy calculator to help the doctor do their job and focus their time on the right things. And I typically like to use the example of asking a room full of people, how many of you would be comfortable with getting a chest CT and having a AI help the doctor read that scan and diagnose it? And usually I'll find that everybody raises their hand. They're all okay with AI helping a doctor do it. Then I'll ask,
should we try?
Sure.
Why not?
Great. So how many of you would be comfortable with AI helping a doctor read your scan? Great. Now, how many of you would be comfortable with AI reading the scan without any human in the room? Great.
See?
Now, I got one worse. Now, how many of you, of the few people that kept their hand up, would be comfortable with when the software, with no human intervention, determines you have a malignant lung nodule, sticks a robotic needle into your chest in order to extract it and give it a biopsy? I would be shocked if anybody kept their hand up.
Right.
Because ultimately, even if the computer is going to make a better decision, you feel a lot more comfortable knowing that
when there's a human being involved.
Exactly.
Yeah.
And I think what a lot of people lose sight of is that radiologists are really connectors within the diagnostic journey. The vast majority of patients these days are going to see a radiologist at some point, or rather a radiologist is going to see them.
Right.
And ultimately, the radiologist is the detective. They're the one that's gathering diagnostic information from everybody else and then intrinsically imaging you and trying to determine what's wrong. What they do is communicate. And where radiology loses a lot of its accuracy is when people stop doing that communication. And ultimately, where we think the technology is going to help is that it's going to do the menial labor for you of prioritization and quality checking. It's going to automatically calculate volumes and measurements for you and do longitudinal comparison so that you as the human can make a better inference about what that means and what we should do about it and care for the patient along the way. So I think if the question is, when will the robot doctor see you without a person, I think it's long enough from now that it's not worth necessarily
worrying about yet.
However, if the question is, when can you go in and have a doctor have AI help them read your scan? Already, right now. And ultimately, it's getting even more ingrained in every aspect of the clinical workflow.
And Deepak, I wanted to ask you, of course, when we talk about cloud technology, for a layperson, it's easy to understand or to sort of understand its implications for sectors like technology, telecom, even to an extent retail. But just how revolutionary an impact can cloud technology have in the world of medicine and healthcare?
Yeah, great question, right? In terms of, we've seen that evolution and that has actually taken place in sectors like retail and everything, and it's easier to imagine in those places. But think about this in terms of, if you look at purely from a population perspective, right? Over 50% of the world's population is in APAC, in this region.
Yeah,
right?
India,
so which is like 3.5 billion people. Obviously, if you look at the square footage from an area perspective, it's nowhere near to the rest of the world from that point of view. So obviously, it is dense.
Yeah.
While it is dense, it is also true that this population is highly distributed, right, in remote areas. And we have an unfortunate situation today where your patient or nurse ratios to number of people, we barely have a doctor for every 1,000 people.
Correct.
So, there is no other way than technology helping to be able to reach those people who are in the remote areas. They just don't have access to that healthcare. They just don't have the affordability to an extent. And, the efficiency of being able to get a diagnosis, let alone treatment, is difficult. So the only way is for that technology to be able to do that. So now thinking about from a technology perspective, how is cloud going to help?
Yes.
Right? The idea is that, while technology is improving to provide accessibility in the sense in terms of connectivity, now, we have much better connectivity than 5 years ago, even to the rural parts, even to the remote parts of the world. And it's only going to get better with the 5G implementation and what have you. What this gives is the ability to be able to collect data in those remote areas, with the patients, typically, with the Internet of Things in terms of the devices that can actually collect such data, to be able to get that data into a place that we call cloud, right?
Yes.
Which is now accessible to anybody in the world, right? So a doctor could be any place. He doesn't have to be in the same remote area where someone needs to walk across. But the doctor can actually access that data. And
anywhere in the world.
Anywhere in the world, and be able to, provide not only just diagnosis, but be able to provide the treatment, the course of treatment in terms of what needs to be done. Whether, is it an emergency to be able to actually really, airlift a person to get an ambulance and get to the nearest hospital, or is it just a medication or whatever that kind of judgment? These things can certainly help save lives. It's
Sure.
as big as that. And I think that's where the cloud technology being able to enable the access of data from anywhere in the world to anybody who is authorized to do so is what it provides. And in simple ways, you can actually put the data where it is accessible to everyone.
Yeah. Kevin, I'm curious. I know that you're still in the development and trial phase of your technology. Have you tried it in areas where there is a big gap between the number of doctors and the population? Have you tried it in remote areas, and how has it worked?
So despite still developing many aspects of our technology, we have done a lot of trial work and a lot of projects in the US, Canada, Australia, China, Japan, a few other countries. And I think China's a great example of where you run into a lot of issues like that. And I'll also use the example of some of the work that we're looking at now in Africa and other developing countries. But in China, accessibility for a doctor is a huge issue. In that, the first Chinese health check network that we started working with many years ago, they do 5 million chest x-rays per year. That's one company, 5 million chest x-rays.
That's a lot.
And because it's a health check setting, 98% of those patients are going to be totally healthy. So if all we did was up front tell them which ones were the healthy patients, still requiring a person to look at those scans, of course, but enabling them to put the 98% in one bucket and the 2% in another bucket, opens them up to then mobilize their radiologists in a much more effective way, such that their small number of clinicians can start to treat a much wider population. But ultimately, the first challenge that we ran into in China was that we can't deliver AI to them unless they're connected in the first place, which is where really I see cloud being exactly as you said, the tremendous help in this circumstance. To paint a couple of scary statistics for why all of this is important, on a global scale, about 500 million people this year will get some kind of radiology study, an X-ray, a CT, an ultrasound, an MRI. Unfortunately, roughly 1 in 5 of those patients, so around 100 million people, are going to have some kind of misdiagnosis, meaning they might get some kind of treatment they didn't even need. And unfortunately, another quarter, there's some overlap there, but 125 million people are going to get some kind of missed diagnosis, meaning they might never get treatment that they desperately
should have. Yeah.
But what's most frightening to me is that 5 billion people, 70% of the world, lacks access to diagnosticians altogether, which is why they're not part of that statistic in the first place. And the biggest thing that we can do to benefit them now is cheap connectivity. Some of the most interesting companies that I see in developing countries are ones that are building low-cost software to simply telemeter radiology data and other clinical data to the cloud. Because in Africa, you're going to find that your average clinic is the only one for maybe 3 hours in any given direction.
Right.
And there is no radiologist there. There is a radiographer there. It's the person who takes the image, not the person who reads the image. But now they're on the hook to read it too. So I think the first problem is being able to connect them to the outside world so that somebody can provide that consultation and help them. The secondary thing to do to help them is then deploy AI to be a part of that workflow.
Deepak, I wanted to... No, please, of course.
So what Kevin talked about, I couldn't agree with more, and I thought of an example that we deal with or we work with is, we at NetApp, we have a corporate accelerator that we run out of Bangalore, where we mentor, and in each cohort we have 6 startups. One of those startups called CardioTrack in the healthcare industry. They make these devices which are like your mobile devices, and that can actually capture your cardiogram and the ECG. And it does not need a doctor. It does not need a nurse. It is very simple. It's a simple device that you just hook up and it captures your ECG. One of the things in India is the cardio issues are something that is very vast, right? It is rampant, and to be able to get an ECG on that device, and just like Kevin was talking about, the ability to be able to transmit, just like a radiology data, you transfer that ECG over to the cloud and have somebody be able to look at it, let alone have somebody able to look at it, but it gets first processed through an AI model, a deep learning model, which eliminates all of the very common diagnosis, right? They look for patterns that are known, that are 100% sure where your error rate is so less that it is negligible. Hopefully 125 million people won't have to have misdiagnosis or what have you, but that is something that's already there. It's wonderful in terms of, without necessarily having a doctor, you can actually check an ECG, be able to send it, get the diagnosis, and be able to get treated.
And I want to stop you right there and ask you, can you demystify the process for us? How does a technology actually work?
Think of it as, in what we look at. I think Sanjay, when he talked about the data fabric, right? The idea of being able to build a pipeline of data, we call it a data pipeline. You start from the edge device, right, which is where the data is collected, whether it is radiology, whether it is ECG, whether it is actually a sample, a blood sample, a urine sample, what have you.
Or like an X-ray, that would be considered an edge device.
That's what I meant by radiology, right? And an X-ray.
Right.
So that is an edge device which collects that data. The idea is to be able to take that data at the edge, and typically what happens at the edge is that you get a lot of data. And you don't necessarily need all the data if you have some compute power, some processing power at the edge. So what you do at the edge is to be able to do what little processing you can do to be able to really extract the data that you need.
So you sift through the data and take what's relevant.
Right, and then you aggregate that, and then you get it back into a central zone that we typically call a core. A core can actually exist in either a private cloud, a public cloud, or a hybrid cloud, as we call it, right? Which is either in your data center or in the cloud, whichever way. It doesn't really matter. So this aggregated data is what comes back most usually to a core or a cloud area, mainly because you cannot afford to be able to run these deep learning models, the AI models, on the edge. It just doesn't have enough processing power.
Sure.
So what happens when it comes to the core is that you have the power like the DGX or other, such compute power that you have the ability to process that amount of data. So what you do is you take that data and put them through the models that are constantly learning, as time goes by, as it recognizes a new model, or when it is taught a new model, it continues to learn, and it starts diagnosing those early enough and be able to provide that analysis of the data to a physician, to whoever, who can actually make those decisions much faster.
Sure.
Because 60% of the work is done. They don't have to go through all of the same eliminations. They don't have to go through all of those models manually. And that compute power and that power of being able to process that data, analyze that data, compare it against the known artifacts as far as the patterns that determine what potential disease or trouble somebody might be in, and allows the doctor to be able to make that diagnosis so much more faster.
So much faster, which is where I want to bring you in. Can you give us a sense, since you've been running so many studies, of just what the benefit is of using a computer, using cloud, using AI data to read an X-ray report? What's the benefit to doctors, to patients? Can you give us a sense of how good it is?
Sure. We typically look at 4 primary benefits that radiologists get out of using our software and recognizing that anything we build, all the differences made by what stage of workflow we actually integrate that into. So what goal are we trying to bring? The first is efficiency. So it's a lot easier to get through the scan much more quickly if we automatically measure in 3D space every single thing you click, and then we automatically bring up every historic study that you've ever had and automatically measure that same stuff for you back then. Every time a radiologist has to do that, it takes them a lot of time. And ultimately, their methodologies for measuring things like volume are pretty primitive. They'll measure, because logistically they have to, a single diameter axis of a finding and then plug it into the formula for the volume of a sphere. I've never seen a lung nodule, for example, that is a perfect sphere. So not only is it not a good use of their time, it's also just not a very effective method. The second major benefit we see is improved true positive rates. It's much harder to miss that subtle lung nodule hiding behind the cardiac shadow if we circled it for you right up front and pointed your attention to it. The third is lower false positive rates. So you're much less likely to biopsy that lung nodule if we can give you 37 reasons why it's actually benign. And then the last one, which is probably my favorite example, is emergent insights, which are basically actionable patterns that one could only act on if high compute AI were to point that pattern out for you. And a good example there is early detection of malignancy. We often pick up malignant lung cancer up to 24 months earlier than human radiologists do, which of course can make all the difference between something that $1,000 surgery will fix and something that ultimately no number of millions of dollars will make any difference on. And I think extending that to a population setting is where we're really going to see those benefits. Now, in the United States, interestingly enough, people get the impression that it's not free healthcare. We do actually pay for healthcare. We just wait until the most expensive possible point in time to do it. And that creates a culture where people are afraid to go to the doctor because they know what the bill is going to be.
Correct.
However, the bill would be nothing if you just went to the doctor every year and we picked it up years in advance of when that problem actually became an issue. So I think those are really the high-level benefits that I see. In terms of where this integrates into workflow, our products essentially let you pick at what stage of the patient journey you want these things to kick in. So basically, when does the AI tell you what it thought relative to what you thought? So one way we can do things is at the time the image is captured. So as the image is being captured, what if we can make your MRI take 10 minutes to capture instead of 60 minutes? Right. So that you don't need to lay in a tube for an hour. The next level downstream from that would be triage and prioritization. So after that image is captured, but before a person ever looks at it, which on average in the US without any AI help is about 72 minutes, now we have the ability to find interesting things in those studies and bubble them up to the top. So if there's 100 people waiting to have their head CT read and one of them has a brain bleed, we probably want that person to be the first one that gets medical attention. One level downstream from that would be real-time clinical decision support. That's the one where as you click stuff, we tell you what it is and trace it through time, and in some cases even generate the report for you so you could just correct us where we're wrong. And then finally, one stage further downstream from that would be retrospective insights or second opinion. So you try to submit that report about the chest x-ray, and we shake the screen and say, what about that lung nodule? And then reveal the heat map at that point. So kind of like spell check for radiology.
Sure. Yeah. You know, we've been talking so much about data, and data is central to what you both do. And at this point, I'm going to ask all of you to get ready with your mobile phones, because I am going to include you in the conversation with a poll. And I do want to talk a little bit more about data, because when I hear the word data these days, I get a little worried. And the reason I get worried is I worry about my privacy. Everything I sign up for, everything I want to do requires me to submit some sort of information about myself. And I worry, and we're sitting here in Singapore where we had a massive data breach last year in healthcare. Even the Prime Minister's health records were leaked, you know. Whose responsibility is it to keep it safe? I'm happy for either of you to jump in here.
It's a very interesting question, and I don't think, you know, to be honest with you, I don't think there is a perfect answer yet that has come out. I think there are, you know, certainly, you know, Singapore came out with a policy in terms of how to use AI, and you know, and most countries are actually have come out with some of the data privacy laws and data localization in terms of, you know, what data can leave and what data cannot leave, and what have you. But when it comes down to personal data, you know, and especially more so from a healthcare perspective or what have you, that data primarily is owned and controlled by the person, but who handles that data? Because this data travels through multiple points in time,
right,
and there are different organizations or different classes of organizations that actually handle. Like, let's say, for example, you know, there could be a set of you know, ISVs that are intermediary that are, you know, taking or collecting all of this data, and eventually, you know, through multiple points, it flows through, you know, I don't know, to a physician or to a government organization or whatever, you know, it may be, and where, you know, where does that control point lie? Right?
Correct.
There are also infrastructure players like us, for example. Right? We provide the infrastructure for organizations to, you know, manage their data, and we provide all of the capabilities in terms of being able to protect the data, being able to secure that data in every way possible. But then again, it is a question of somebody using those features to be able to protect their data. To the most point, you know, what I've seen is it's predominantly dependent in the last mile as far as who has the access in the last mile to that data to make sure that before they expose that data, they are, you know, responsible to be able to make sure that they adhere to whatever the person's, you know, wishes are to be able to explore. You know, Kevin, you have any thoughts?
Actually, Kevin, I'm going to bring up the poll, and I'm going to have you respond to the poll. And the poll, you know, it comes down to I think of it as a question of trust, isn't it? And
it is.
It's a question of trust, and it's a question to all of you in the room. Very simple question. Who do you trust more? Would you trust a human to handle your information, like if you took a file with your medical records and you went back to the doctor each time, or you kept a file in your doctor's office? Does that make you feel like your data is more safe? Or giving a lot of data, personal data about yourself to a computer? So, ooh, it's close. Ooh, this is the most exciting poll because it is, it's changing. Okay. Kevin, do you want to respond to that? So 57% of the room thinks, yeah, a computer.
Hopefully I don't bias the results too much, but I'm very heavily in the camp of computer on this one.
I knew.
Now, while on the diagnostic sense, I might be a little more on the human side, I think on the data security side, definitely a computer. In every country, I've shadowed radiology now in 20 different countries around the world. In every single country I've been to, they still burn your data to a CD. The moment they burn your data, that CD, they are admitting that they don't care remotely at all about your security. And the moment that you lose your sight of that CD, you're admitting that you don't care either. because there is no encryption on that disk. Any person, the only reason why not everybody will have it at that point is because very few people still have a disk drive on their computer. And from our viewpoint, there are a lot of ways that we need to tackle data security to actually make it something viable within a healthcare space. For one, we do our deployments on site so that your patient data never needs to leave your network if you don't want it to. Always stays in your data center along with all of your other software and hardware. Another way that we tackle this is with very sophisticated methods of de-identification of patient data. Ultimately, to give a couple examples of that, when we get your medical records and your images, obviously we'll scrub your name and date of birth and things like that, but we will also artificially shift the dates on every single one of your studies, such that even if somebody happened to break into the hospital and knew what days you went to get your different studies taken, there would be no way that they would be able to actually link that back.
Because you've scrambled that data.
But we do it in a clever way, that we can still link things up. For each patient, we generate a random number between 1 and 30, and we shift all of your studies consistently by that amount. That way we know what order they came in, we know how far they were apart, but we don't know what day they actually occurred on, which is superfluous information anyway. We additionally look at the image itself. Maybe you got an X-ray while wearing a dog tag with your name engraved on it, and so now if somebody did the forensic analysis, they can find your name. We use optical character recognition to see when that happens, determine if the text is a name, and then scramble that so that it won't confuse a person looking at it in the future or an AI. We additionally look at the handwritten notes, and we do optical character recognition on that as well with natural language processing to see if the name or date of birth is there. The scary part is that with a head CT or a brain MRI, we can actually digitally reconstruct your face, which if you had access to a facial database could be used to track down a person. So we additionally do facial scrambling to such that anybody who got access to our data, it would be impossible for them to even do that. We take it very seriously. And for that reason, major hospital systems around the world are comfortable with us coming in. I think they mostly recognize that, if anything, we're making their data far more secure than it was before. Because ultimately, even if you could somehow break into the impenetrable fortress that we deployed this thing on in the first place, you would have no idea what you're working with after that point. And I think that these are the kinds of initiatives that we need everybody to start taking, that you can never be too safe with patient data, and you always have to go the extra mile.
I have 2 more questions, and I'm going to ask you all to be quick because I know we're running out of time. So just quick answers to both these questions. But when we talk about AI, we talk about data, we talk about privacy, we also talk about jobs. Is this going to put doctors out of jobs?
Put doctors out of jobs? No, I don't think so. First of all, if you look at it, we barely have a doctor for every 1,000 people. So I think the doctors are going to be in a much better situation to be able to do things faster, to be able to do things in a much more efficient way, and in fact be able to reduce the healthcare cost overall eventually, right? I mean, the healthcare cost is crazy these days in most parts of the world. So to be, I certainly don't believe the doctors are going to go away, anytime soon. Even if there are some of the common surgeries will be done by robots, and I think there is more than enough, for doctors to worry about than to, really think about their jobs.
Kevin, you?
I think my favorite quote on this comes from Professor Kurt Langlotz at Stanford. He runs their medical AI program and is also sort of the grandfather of structured reporting in radiology before the AI days. And he said, AI will not replace radiologists. Radiologists who use AI will replace those who do not. And I think that could not possibly be more true. I mean, people are afraid that this is going to intimidate radiologists or budding radiologists from moving into the field. If that were the case, then why was it that last year was the first time in US history that every single radiology residency position in the whole country was filled? And it wasn't because they lowered the amount of supply for those positions, it's because the demand was so high. People are so excited by the idea that they're going to be able to work alongside AI in order to become far better diagnosticians than they could have in the past. In many ways, it's going to lead to more jobs for clinicians, because if we can finally open up the 70% of the world that lacks access, well, then that opens up a tremendous need for even more doctors to be trained. And ultimately, the kinds of things they'll be focusing their time and attention on will be the more interesting aspects of it, where they actually have their passion, not the menial tasks that currently take up most of their time.
Look, we live in a data-driven world, but we also live in a world with a lot of political uncertainty these days. And I'm sure you've seen the news today out of Hong Kong that Carrie Lam has decided she will formally withdraw the extradition bill. So we'll see what happens in Hong Kong. But there has been a lot of uncertainty there. Trade tensions between China and the US, that has been said is one of the reasons that caused NetApp to miss its revenue targets, and unfortunately your share price is not ideally where you would have liked it to be at the moment. How do you plan to get it back on track?
Well, so the macroeconomic conditions are the same for everyone, right?
Right.
So all of them do face it. And, you know, to the most part, as far as like, you know, things like stock price, we don't necessarily comment on. And in fact, our CEO, George Kurian, actually talked about it in detail in the last, investors, update after the quarter. And he talked about it in detail. I would just definitely refer anyone to listen to the transcripts in terms of that. But there are certainly, macroeconomics that is, that does impact various different organizations, and nothing in particular from a NetApp perspective is what I would say.
What about you, Kevin? Any impact on your business or your plans with all the political uncertainty?
Unfortunately, it's hard enough for a company based in the US to work in China. It's hard enough for a company not in China to work in China.
Right.
And our strategy for working with really any industry outside the United States is to recognize what we know and what we don't know. We're good at tech and we're good at product. We're not good at sales and distribution or regulatory approval in foreign markets. We rely on partners to do that. And unfortunately, events like this make it very difficult for us to attract those partners, largely because most of our investors are partners who want to share in that. And unfortunately, we've had to turn away some of those opportunities in recent history. And that's obviously disappointing from an economic standpoint, but it's far more disappointing from the standpoint of why we do this in the first place, which is to fix some of those issues that we were talking about earlier. And ultimately, regardless of what intentions either party might have, it is inhibiting our ability to improve that condition.
Well, I wish you both good luck in both your businesses.
Thank you.
Great. Thank you very much for your time.
Thank you so much.
Thank you.